you all. Kathy, I'm so grateful to be here. And Dr. Bonnie, I got to see her office yesterday, and I know about all the work you do. And I'd love to see some more. Hopefully I get to come back. You know, on the way over here this morning, I was talking to Kathy about, the 400,000 children in this county and how hard you work to get coverage for them all. And then beyond the coverage, to get care for them all, and these are all triumphs. And I know you work in the trenches of this every day, otherwise you wouldn't be here. So I'm not telling you anything you don't already know, but hopefully my stories and experiences can help remind you that, this is going on everywhere, and you're leading the way in many ways across the country. I didn't think much about oral health or the need for dental care until I was working on this particular story as a reporter for the Washington Post. So I'll tell you a little bit about that and what happened. This is something I'll just read a couple paragraphs first, though. This is something I learned about teeth as I worked on this project. It took me about 10 years. The teeth are tools we have been given to survive. We use them for eating, for speaking, even for defending ourselves. Their mineral beauty is a kind of gift. There is the uncanny way they are part of us, the unsettling ways they leave us. The teething pains of infancy herald the appearance of the baby teeth, the deciduous teeth. Their shedding and replacement with the permanent teeth are part of our passage from childhood to adolescence. The eruption of the third molars, the wisdom teeth, signals the advent of young adulthood. As time goes on, our aging is reflected in our teeth. They wear and darken, the gums recede, and we grow long in the tooth. Time and disease take their toll. During our lives, their enamel is demineralized and remineralized in regular cycles. They are washed and cleaned by the saliva. When we brush, we disrupt the plaque that lives on them. Fluoride can help strengthen them. What we eat and drink can make them more vulnerable to decay. So can neglect. So can the lack of professional care. Infection takes hold. Beyond a certain point, the teeth cannot be repaired. In small ways and large ways, the teeth call us back to ourselves. They call us back to suffering, to beauty, to our time on earth. It was in the year 2000 that Surgeon General David Satcher warned of a silent epidemic of oral disease in America. I got my first glimpse of that epidemic in 2007 as a reporter for the Washington Post at the hospital bedside of a 12-year-old boy named Diamante Driver, suffering from complications of tooth decay. Diamante and his brothers had been able to find routine immunizations and the other healthcare services they needed to attend school and play sports and grow up not too far from the U.S. Capitol in Washington, D.C. But they were growing up in Maryland in a poor community, and dental care was far scarcer for poor children in that community, and even in that rich state, and as it is in the rest of America. Dental care is provided through a completely different and separate service than the rest of health care. Diamante's mother had actually been trying to find adequate dental care for his younger brother when Diamante came home from school one day in 2007 with a headache and sinusitis. His grandmother, they didn't have a regular dentist, as his grandmother took him to the hospital, a little community hospital, which is what, people do when they don't have any other option. And he was diagnosed with sinusitis and a dental abscess, and they gave him some medicine and sent him home. But he just got worse. A couple days later, his mother took him to another hospital, another county hospital, and By then, they did a spinal tap. They found out he had meningitis, and he was rushed to Children's Hospital, which is this great beacon of health and salvation for children in Washington, D.C. The doctors in Washington told his mother that bacteria from the abscessed tooth had spread to Diamante's brain. They did 2 brain surgeries, $250,000 worth of care. He stayed in the hospitals, and then he was moved to another rehab hospital, but after 6 weeks, he died. Routine preventive care or timely restorative care might have saved him. But fewer than, as I learned as I reported the story, fewer than 1 in 3 of Maryland's Medicaid children had received any dental services at all in 2005, which was the latest year for which figures were available at the time of Diamante's death in 2007. Fewer than 16% of the state's Medicaid children had received restorative care. You know, far fewer than half of dentists were participating in Medicaid. Far fewer than half of kids were getting care anywhere in the country, and that was true. It's true today still, that fewer than half of Medicaid kids get even basic dental visits of any kind, and fewer than half of dentists participate in Medicaid. And the problem isn't just limited to children. I know we're here to talk about children, but we all know that parents' oral health has a huge impact on their children's oral health. Roughly 1/3 of us here in this country experience significant barriers getting access to regular old dental care. Just well over 100 million Americans face significant barriers getting access to the separate, carefully guarded, insular dental system that provides care. It's basically a private practice system. And like Dr. Pearl said, sort of a cottage industry. Children are entitled to dental care under Medicaid and have been since the law was, since 2 years after the law was signed. In 1967, they were granted entitlement to dental care under a provision of the EPSDT. Adult dental benefits have always and continue to be considered optional under Medicaid. They vary from state to state. They always disappear when the state goes through a difficult time financially. I know you've been through that here in California. Thankfully, the benefits have been restored now, but they go away and they come back. Medicare has never entitled retirees and disabled Americans to dental care, so tens of millions remain without dental coverage. And 50 million Americans live in dental provider shortage areas. Over 5,000 communities across America have shortages of providers. And these are all barriers to getting routine care. People are older, they're without money to pay, they're without benefits, they live in isolated areas. They live in communities where, like the Driver family lived, there are just not enough providers who accept their benefits. I learned that the private practice system that provides most of our dental care was born just about 30 miles from where Diamante Driver lived and died. It was in Baltimore in 1840 that the world's first dental college was established. And those dentists in those days, they didn't have professional training. I mean, they learned in the best of circumstances. They learned from somebody who had experience. They learned their skills, and they got up on their horses, and they rode from town to town. They opened up a little temporary visiting place, a tavern or a home where they do care, and then they go on mostly extractions, some restorations. But 2 men who had, studied this and learned about what was known of the science of health and disease in those days, went to the physicians of the University of Maryland Medical School and proposed that they add a course of dental training, to the course of study there. And as the story goes, the physicians told them that the study of dentistry was of no consequence. And they sent these two early dentists away, and these two men, Chapin Harris and Horace Hayden, started their own dental college a few blocks from the medical school. And it's the University of Maryland Dental School and medical schools are still like right across the street from each other, you know, and they're still separate. And almost every dental school in the United States, it still remains without any institutional connection to the medical schools. And our whole system grew up around this kind of historical accident, this creation story, and it remains so, you know? And we talked a little bit about integrating care, you know, and of course Dr. Satcher in his report talked about the head is attached to the body. Of course oral health affects overall health, but our system really doesn't reflect that to this day. And it's not just an academic problem for medicine and dentistry, and but it reflects our patient records are not kept together. Medical and dental research are often done separately, and these patients get lost in this gap between the two systems. Well, when Diamante died, I wrote this story. It was just a horrible story to have to write. And as a journalist, you don't know what's going to happen when you write a story or a book for that matter. You don't even know if anybody will even say anything to you. But when this story ran, the reaction was swift and immediate. And I'll read you a scene from a congressional hearing. Part of it was like this time we're living in now. There were some sharp divisions in Congress about what the government's responsibility is, whether our federal government has a role, you know, in providing health care. Strong divisions, but it led the Democrats had a voice in the House, and boy, they used it. Others died of dental infections before Diamante Driver, and others have died since. But it was Diamante Driver, who died just a few miles from the U.S. Capitol, who was spoken about on Capitol Hill. His story became part of the battle over the reauthorization of the state, what was then called the State Children's Health Insurance Program. Now it's CHIP, Children's Health Insurance Program, and the guarantee of dental benefits for 7 million children from working poor families. And it was the boy's image, captured in a school portrait, his head cocked questioningly, his white shirt buttoned to the collar, his searching eyes that gazed down on the lawmakers from screens in the hearing rooms of Congress. His face became the face of millions of children. Diamante had been a Medicaid child. The program entitled 29 million poor children, well over a third of American children, to dental care. It was care that most of them were not receiving. With all the resources available to us, Maryland Representative Elijah Cummings thundered in one of those hearings, how did we so thoroughly fail this little boy? Look at his face, Ohio Congressman Dennis J. Kucinich said. I mean, he's really just asking us, what are we going to do about this? Are we going to take a stand to make sure the children of America get the dental services they are entitled to? Maryland Senator Barbara Mikulski, trained as a social worker and old enough to recall the beginnings of Medicaid in the Johnson era, would remember the boy as a soldier in the war on poverty. For lawmakers like those, the boy's death was a reminder of the monumental initiatives, the grand speeches of Johnson and Roosevelt, of their assurances that America, through a collective effort, could supplant the fear and pain of poverty with dignity and health. But for others, the boy's death was just more proof of the futility of such giant federal programs. For them, the welfare state itself bred and perpetuated stigma and despair. For liberals, Diamante's rotten tooth was an emblem of the importance of fighting to strengthen S-CHIP and Medicaid, programs aimed at ensuring that children received the care they needed to grow into healthy and productive adults. But for many conservatives, the stigma of the welfare state endured. For them, Diamante's rotten tooth evoked the inability of any government program to save the poor from themselves. The personal havoc wrought by one small decayed molar became part of the huge and ongoing debate over the size and scope of the nation's government. The federal deficit was growing. Democrats blamed the Republican tax cuts and the costs of war. It was the war on terror in those days. Conservatives blamed liberals for runaway domestic spending. The Deficit Reduction Act of 2006, passed with a tie-breaking vote by Vice President Richard Cheney and signed by President Bush, stood poised to cut nearly $40 billion from the nation's spending in the next 5 years. One of the programs targeted for billions in cuts was Medicaid. Well, they went on fighting, and they still are. Those $40 billion in cuts sound small compared to what they've been talking about recently. Mm-hmm. But you know, the liberals won their fight to add a dental benefit to children's health insurance program. It took until President Obama came into office, but that was one of the first things he signed when he got in, was he reauthorized a children's health insurance program with a guaranteed dental benefit for those 7 million children, and now it's 9 million children. And progress has been made on the national level too. And on a state level, a new governor then, Martin O'Malley, tackled the program in the state. He appointed an interdisciplinary panel of experts, put a dental hygienist in charge, and said, fix our system, come up with something. We got to fix this right away. He was mortified and ashamed that this had happened. And they did come up with a set of very simple, actionable goals, and those things were put into place, and they included things like reimbursing physicians and nurses to do well baby checkups, parent education, fluoride varnish applications for the little new babies that they're still more likely to see than dentists in their first years of life. They gave dental hygienists a chance to go out into the schools and do screenings, fluoride varnish research, applications, get children with really serious needs in to see dentists. They worked with nurses, school nurses, and they revamped the system so it was less bureaucratic. They did raise reimbursement rates for dentists, and they kind of told the dentists to step up to the plate. They said, if more of you don't participate, we're going to have to look at other dental workforce options, which kind of got them galvanized to step up. So a lot more of them started participating. So Maryland likes to brag they went from worst to first. They still have no dental benefits for adults at all, so they're working on that now. They're saying, hey, we did such a good job with the kids. Let's restore some dental benefits for adults under Medicaid. And on a local level, I gotta say, they raised this local chapter of the National Dental Association, which is the African American Dental Association in the country. Their local chapter raised money and got a mobile dental clinic on the road. And I spent a lot of time on this dental van, and it was just amazing. I'll read a little scene from that. This was the 5-year anniversary of Diamante's death. On a weekday morning at the Prince George's County Health Department, the 5th anniversary of Diamante's death was marked with speeches and a breakfast buffet. Congressman Elijah Cummings was there. He quoted the prophet Jeremiah. My son is dead, he began, standing beside a large photograph of Diamante. In the audience was Elise Driver, Diamante's mom. She was dressed in her scrubs with tears in her eyes. It turned out one of the local dentists in the National Dental Association trained her to be a dental assistant, and she'd started volunteering on this free van. The Diamante Driver Dental Project mobile clinic van was parked outside, and it was offering tours to dignitaries and care to school children. Elise Driver took some fruit from the buffet and climbed aboard. She quietly went to work beside a volunteer dentist, Mafone Yamorin. One by one, Elise Driver guided children back to the dental chair, removing their woolen hats and wiping their runny noses, tucking the paper bibs under their chins, comforting the ones who were frightened. She took up the clipboard with a paper chart for each child. She listened as Dr. Umoran examined each tooth and offered her assessment. She used a red pen to mark the disease places on the chart. Around Elise Driver, the mobile clinic bearing her son's name was a small, plain, well-lit world, like a drop on a microscope slide. At any given time, it contained a dozen people, children giggling and whimpering, Doctors Umoran and Carver Taylor and Betty Thomas, visiting officials from the county and the state. The instruments whirred and pulsed, and beneath their sounds, there was the hum of the generator that powered the vehicle, the hum of the battle against disease, the battle for health, plain and ordinary, being fought, one tooth at a time, at the heart of the silent epidemic. Nationally in 2016, oral health advocates and officials hailed as great news the finding reflected in federal data that the percentage of Medicaid children receiving at least one dental service had risen from 29% in 2000, the year that Dr. Satcher came out with his Oral Health in America report, to 48% in 2012. Still, that means that more than roughly 18 million children did not get care in 2012. So the work goes on. And we continue. Oral health advocates worry that the fragile gains that they made in those years are in jeopardy with talk of block granting and capping Medicaid and taking away the entitlement of dental benefits, which is what a cap would mean, which is what a cap would mean, really. My copy of Oral Health in America is falling apart at the seams, but I keep opening it. I keep it near my side at all times. And I look at Dr. Satcher's call to action that's at the end of the report. It's an appeal for increased research, the removal of barriers to care, the raising of awareness about the importance of oral health among average citizens, lawmakers, healthcare providers, and the building of an American healthcare system that, as he said, meets the oral health needs of all Americans and integrates oral health effectively into overall health. So thanks so much for letting me speak. And thank you for all you do.